Hi, my name is Kalie Austin, and I'm going to start out by defining collaboration. According to Hansen and Carter, collaboration is a dynamic interpersonal process in which two or more individuals make a commitment to each other to interact authentically and constructively to solve problems and to learn from each other to accomplish identified goals, purposes, and outcomes. Collaboration involves partnership, shared values, commitment, and goals. This interpersonal process allows two or more people to interact to solve problems, but at the same time, they are allowed to have differences in opinions. Collaboration can take place between two healthcare providers, but also between the healthcare provider and other professionals, patients, or communities. Hansen and Carter define four types of collaboration. The first type of collaboration is multidisciplinary. Multidisciplinary collaboration is collaboration between different disciplines. The second type of collaboration is interdisciplinary. Interdisciplinary collaboration is collaboration within a healthcare team. The team members are all committed to providing care for the patient. The third type of collaboration is transdisciplinary. Transdisciplinary collaboration is when team members teach each other and work together to learn and provide care for their patients. The fourth type of collaboration is interprofessional. Hansen and Carter describe interprofessional collaboration as the interactions of two or more disciplines involving professionals who work together with intention, mutual respect, and commitment for the sake of a more adequate response to human problems.
Hi, this is Jeremy Courville. Now that you've heard our group definition of collaboration as it pertains to advanced practice nursing, it is now important to explore why Hamrick feels that the role competency collaboration is important enough to include as a core competency of advanced practice nursing framework. Collaboration is one essential feature that Hamrick et al. Expects every advanced practice nurse to blend into daily practice encounters. The role collaboration is differentiated by unique competencies. Sophisticated communication and interaction are essential competencies in collaboration. As with other role competencies, collaboration is an acquired skill. In order for collaboration to work, the provider must recognize the expertise, skills, and knowledge that other providers contribute and be willing to equally share information to meet a common purpose. Collaboration happens between individuals, work groups, and organizations. When working with individuals, a common goal must be established. When working in a group, teamwork and leadership must be used to achieve a common outcome. When working in an organization, we collaborate with organizational leaders and policymakers. It is necessary to clarify what roles and responsibilities each member will have in the team. Common goals or purposes will fail if providers are not willing to collaborate. Because the competencies contained in the role collaboration overlap with its characteristics and traits, our group will now talk about the characteristics and traits of collaboration.
Hello, my name is April Wilson, and I will be presenting the characteristics of effective collaboration. The essential characteristics of effective collaboration are as follows: clinical competence and accountability, common purpose, interpersonal competence and effective communication, trust, mutual respect, recognition and valuing of diverse, complementary knowledge and skills, and humor. Clinical competence and accountability. Clinical competence is perhaps one of the most important characteristics of a successful collaboration experience. Clinical competence can lead to trust and respect, as each member relies on the other to be clinically competent and perform their roles well. Clinical competence can also lead to shared leadership. Shared leadership can offer different perspectives and also learning opportunities. Accountability enhances collaboration. And as APNs share responsibilities, they model a full partnership. Common purpose. Common purpose is the basis for collaboration. Goals can be a starting point. Although each team member must be accountable, there is an interdependence to carry out a common purpose. An example would be the relationship between RNs and physicians. RNs depend on the physicians to write the orders, while physicians depend on the RNs to carry out the order. Each of one of those individuals have separate roles, but both rely on each other for a common purpose, which is to enhance the quality of life for the patient. Common purpose also equals shared vision. It's where you value the differences among partners, but you share the common vision. Interpersonal competence and effective communication. Interpersonal competence is the ability to communicate effectively with colleagues orally or in writing. There are two important characteristics of interpersonal competence and effective communication, and they are transparency and assertiveness. Transparency is the honest and open sharing of information and ideas. Assertiveness is confidence in resolving conflicts, and it can be difficult in new APNs, but it is an important element of interpersonal competence that should be learned and practiced. After clinical competence, interpersonal competence and effective communication may be the next important skill to learn in effective collaboration. Trust and mutual respect. Trust and mutual respect is dependent upon clinical competence, and it can be established in novice APNs that are in environments that support an APN's newness into practice. Respect enhances shared decision making, and respect for others is key to successful collaboration. Recognizing and valuing diverse, complementary knowledge and skills. I look at this essential characteristic as viewing others as a complement rather than competition. It must be a belief that knowledge and skills from others will enhance one's own personal plan, and it's important to display teamwork, value others' disciplines, and learn from each other. Humor. Humor that is positive, non-threatening, and creative can be a way to exhibit effective communication and problem solving among team members. Humor can decrease defensiveness, invite openness, relieve tension, and deflect anger.
Hi everyone, my name is Lindsay Lewis, and I will be providing our examples of AP in collaboration. Our first example of advanced practice nursing collaboration is as follows. A nurse practitioner leads a diabetes type 2 management program. Each NP is assigned patients and collaborates with each patient's specialist. The NP and the specialist coordinate the patient's plan of care together. The NP also collaborates with a dietitian to coordinate healthy nutritional plans for the patients. When the NP collaborates with specialists treating the patients, lack of coordination among care providers is decreased and conflicting medical advice is eliminated. Our second example of collaboration at work involves an APN working in an acute care hospital on a medical floor, and this NP implemented her idea of interdisciplinary huddles. With this idea, hospital physicians, advanced practice nurses, and other members of the healthcare team discuss each patient together at 0700, 1500, and 2100. Patients also receive a daily updated plan of care. APNs, nurses, and physicians attend each other's meetings for chart review and assessment where hospital care can be improved. When all members of the healthcare team sit down at the same table at the same time looking for optimal patient outcomes, readmission rates decrease, infections rate decrease, and complication rates decrease. Average length of stay also has potential for reduction as obstacles impeding discharge are addressed daily in the interdisciplinary huddles.
Hello everyone, my name is Jamila Mathews and I will be discussing what the current research says about collaboration. There is evidence that collaboration among advanced practice nurses and physicians demonstrate positive outcomes for both the patients and the healthcare providers. Collaboration promotes increased patient satisfaction as well as increased personal and professional satisfaction for the APNs by allowing them to feel that their contributions are respected and supported. Collaboration also allows team members to use their abilities and expertise in a supportive manner, which encourages professional growth and development. Collaboration also enhances holistic and patient-centered care by eliminating fragmentation, which allows the patient to develop trust and respect for the healthcare providers involved in their care. Lastly, collaborative care decreases healthcare costs by decreasing the length of stay, and it also increases access to care by allowing the NP and physicians to treat more patients. Research studies regarding the collaboration between advanced practice nurses and physicians provide us with evidence that interprofessional collaboration is effective and yields positive results. For example, Littker et al. Conducted a study that compared the care provided to diabetics and hypertensive patients using a traditional physician-only model of care versus a collaborative team approach. Researchers found that the patients treated by the physician NP team benefited from an increase in HDL levels, which reduces their chances of cardiovascular death by 22%. These patients also experienced a decrease in hemoglobin A1C levels, which is associated with a 25% reduction in microvascular complications. Significant improvements were also noted in interprofessional care, communication with the provider, and overall satisfaction in care. Another study conducted by Susan Meyer and Linda Myers examined patient and economic outcomes between adult patients who received post-operative cardiovascular care from a surgeon alone and those patients who received care from a cardiovascular surgeon and an acute care nurse practitioner. The patient outcome for this study was the length of stay, which was measured in days from the day of surgery to the day of discharge. Contributing factors to the length of stay included the number of complications the patient experienced, the number of readmissions, minutes of intubation, and the number of infections. The economic outcome for this study was the health care system's total cost per patient, which included the cost of the ICU and progressive cardiovascular unit bed per day, as well as surgery, pharmacy, and anesthesia costs. Collaborative post-operative care directed by the cardiovascular surgeon and the acute care nurse practitioner resulted in the length of stay being decreased by 1.91 days per patient, and the total cost decreased by $5,038.91 per patient. Results of this study prove that collaborative care results in positive benefits for the patient by decreasing length of stay and it demonstrates the efficiency and cost effectiveness of the advanced practice nurse. Lastly, Horn, Badowski, and Klingel examined the benefits of implementing a one-to-one surgeon-nurse practitioner model at an urban pediatric hospital. This model was implemented in an attempt to improve quality of care, minimize any obstructions to timely access to care, improve revenue, and increase the patient and caregiver satisfaction levels. Collaborative care within this model included shared decision-making between the nurse practitioner and the physician with the goal of satisfying the patient's wellness and illness needs while respecting the unique abilities of each professional. Positive effects of this outcome included increased patient access to care. This was accomplished by having the nurse practitioner see patients in the clinic as well as post-operative patients in the hospital. This prevented the scheduling of additional new patients for the surgeon, as well as allowed patients to be sooner instead of them waiting until an opening became available. The addition of the nurse practitioner also led to an increase in surgery volume because the physician was able to see more new patients, which increased the revenue for the doctor as well as the healthcare facility. Patient satisfaction also improved with the implementation of this model because the patient and family were able to see the nurse practitioner and surgeon together during their initial visit. Then the nurse practitioner was readily accessible for teaching and answering any questions prior to the day of surgery, and the patient saw the same nurse practitioner in the hospital for post-operative exams and discharge teaching. This approach helped to build a sense of trust and commitment with the patients and their families. Finally, readmission rates were reduced due to this continuity of care. Within this model, the surgeon and nurse practitioner communicated effectively with one another regarding care of the patients, which assured that there were no misunderstandings involving care and that home care would be easily followed. All three studies demonstrate the importance of collaboration within the healthcare system and how it is imperative that clinicians and institutions adopt this competency in order to provide high-quality healthcare services with increased efficiency and cost effectiveness.